Today I'll be doing a physical assessment on Rebecca. Can you tell me your age?
22.
Your sexual development looks appropriate for your gender and age. Your posture is erect, slightly leaned back a little bit. Your grooming appears well maintained, and your facial expression does seem appropriate. Can you tell me your name?
My name is Rebecca Smith.
And where are we at?
We are at Coxville.
Do you know the year?
2011.
Okay. I have a few numbers I'd like for you to repeat. 14, 12, and 24.
14, 12, 24.
Okay. Can you tell me your highest level of education?
I am done with my associate's degree in nursing and I'm working on my bachelor's.
Okay. What did you have for breakfast today?
I had Cheerios.
Awesome. And where did you go to school?
I went to school in Eugene, Cole County, R5.
Wow. Okay. Can you tell me how orange and ball are related?
They're both round.
Okay. Canary is to bird as beagle is to
Dog.
Okay. Your actions and decisions and mannerisms seem appropriate, as does your mood and affect. Can you repeat some words for me? Light, tight, dynamite.
Light, tight, dynamite.
And BMP.
BMP.
Okay. Now I'm just going to take a look at your head. I'll be looking to make sure. Is there any tenderness, anything like that?
Nope.
You do have some bony prominences, which are appropriate. Your hair and grooming is clean and intact. Your hair is light brown to dark blonde. Can you go ahead and take a look at me? Okay. I'm going to check your temporal pulses. Can you open your jaw for me? Any tenderness? Okay. There doesn't appear to be any swelling. Can you go ahead and I'm going to have you close your eyes for me. And can you tell me when you feel certain things, when you have a sensation of the object you want to touch on your face?
Now. 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 Now.
Okay. I'm just going to go ahead and check your sinuses. Is there any tenderness?
Nope.
Okay. If there was tenderness, we would use Turner's illumination. Can I have you raise your eyebrows for me? Snarl your teeth. Great big smile. And puff out your cheeks. Okay? And I'm going to try to open your jaw, and you're going to try to hold it shut. Okay? Next, I'm going to take a look at your eyes. Your eyelids seem intact. Eyebrows and eyelashes are a light brown color and intact. Your lacrimal apparatuses are pink and moist. There doesn't seem to be any excess tearing or dryness. Your sclera is white. Your conjunctiva are pink and moist. No signs of jaundice. Your pupils are round and symmetrical. I'm going to use my pen light to test those. Okay. Your pupils are equal and round and do react to light. Can you go ahead and take a look at the clock? Now take a look at my nose. Okay. Next we would use a Snellen chart, but since we do not have one to test far vision, we'll be testing near vision with this piece of paper. Can you read the first sentence on there for me?
Roses are red, violets are blue.
Fantastic. Okay, now I would use my pen light or an ophthalmoscope to check the internal structure of the eye and the corneal reflex. I want to make sure the optic disc is intact, there's no ruptured vessels, anything like that. Now I'm going to take a look at your ears on both sides. Pull on the tragus. Your external structure is intact. There's no lesions, debris, or excess wax. Then I would use an ophthalmoscope, Next I would use a scope to check the internal structure of your ears to make sure that the the tympanic membrane is intact, there's no scars or damages done, and that it's pinkish gray in color. I'm going to do a whisper test. I'm going to whisper a sentence and I'll have you repeat it for me.
We are doing an assessment.
Okay, and then I have performed two different tests. The Weber, where we put a tuning fork on the center of the head and test to see the sound conduction in both ears, which we would hope would be equal bilaterally. And then the Renee test, where we would put the tuning fork on the mastoid process, and Rebecca would tell me when she stops hearing that, and then we would remove it to test the air conduction, and we would hope the air conduction is greater than the bone conduction. Now I'm going to assess your nose. It is small and rounded in appearance. There doesn't seem to be any lesions. Is there any tenderness?
No.
Okay. I'm going to test the patency. Can you breathe through that nostril?
Mm-hmm.
And that one?
Mm-hmm.
Okay. I'm going to use the pen light or nasal speculum and just check the inner structure. The nasal mucosa is pink and moist. Now I'm going to test your sense of smell. Can I have you close your eyes? I'll go ahead and tell me what you smell right now.
Alcohol.
Okay, that's texturing your olfactory. Now I'm going to take a look at your mouth. There doesn't seem to be any lesions or breakdown. Can I have you open up? Say ah. The oral mucosa, gums, everything seems pink and moist and intact. The uvula is present, small and round, doesn't seem to be any inflammation. The tonsils are also intact. Oral hygiene appears well maintained. How often do you brush your teeth?
Once to twice a day.
Fantastic. There seem to be a few fillings in the back, upper and lower bilaterally. No breakdowns, lesions, anything like that. Are you having any issues with your mouth at all? Can I have you open up real big? Say out for me. Have you stick out your tongue? Okay, there doesn't seem to be any dental appliances. Your tongue is pink, moist, with several small bumps. Any issues with your taste buds, anything like that? Now check the gag reflex, which I'm assuming is intact. Now I'm going to take a look at your neck. I'm going to have a feel. Is there any tenderness?
No.
Can I have you turn your head circles both ways? Fantastic. Okay, I'm going to have you push against this hand and this one. Okay. I'm going to be feeling around for your lymph nodes. Any tenderness there?
No.
Okay. Trachea is midline. And there doesn't seem to be any tenderness or inflammation to the thyroid. Can I have you shrug your shoulders for me? Okay. That concludes our assessment of the head and neck.
Okay.
Hit it again.